You walk into a doctor's office with one simple question, but the moment they enter the room, something changes. Your voice becomes quieter, your confidence drops. You forget what you wanted to ask, and suddenly, the person in the white coat feels less like a normal human being and more like the final authority over your body. But here is the disturbing part. This reaction does not happen by accident. Doctors don't just treat illness, they control fear, they control information, they control the room, and sometimes, without even trying, they control you. Welcome to Mind Trap, where we uncover the dark side of human behavior. Today, we are looking at the psychology of doctors and why the most powerful person in the room is not always the loudest one. Before a doctor says a single word, your brain has already reacted. The white coat, the medical tools, the cold room, the serious tone, the silence before an answer. All of these things create one powerful feeling: authority. Human beings are wired to respond to authority, especially when we believe that person knows something we don't. In normal life, you might question someone, you might disagree, you might ask them to explain. But inside a medical room, most people become smaller. They nod when they don't understand. They say okay when they are confused. They pretend everything makes sense because they don't want to look stupid. That is the first trap. The doctor may not be trying to dominate you, but the environment already has. Because when someone looks like they understand your body better than you do, your mind starts giving them power automatically. And once your mind gives power away, it becomes harder to take it back. Fear changes the way you think. When you are scared, your brain stops looking for options. It starts looking for safety. And inside a doctor's office, the doctor becomes the symbol of safety. That means even one small sentence can feel huge. We need to run more tests. This could be serious. I wouldn't ignore this. We should act quickly. These words may be medically normal, but psychologically they hit like a threat. Your body hears danger. Your brain wants relief. And the fastest relief is obedience. You stop thinking, what are my choices? And you start thinking, just tell me what to do. This is why fear is so powerful in medicine. A frightened patient is not always a rational patient. They may agree faster. They may ask fewer questions. They may accept decisions they don't fully understand. Not because they are weak, but because fear narrows the mind. And when the mind becomes narrow, authority becomes stronger. Now imagine this. A doctor explains your condition using words you have never heard before. Long names, complex systems, numbers, risk percentages, clinical phrases. The more complicated the language becomes, the more dependent you feel. This is the language gap. The doctor speaks the language of medicine. You speak the language of pain, fear, symptoms, and confusion. That gap creates power, because the person who controls the language often controls the conversation. If you don't understand the words, you can't challenge the meaning. If you can't challenge the meaning, you depend on the translator. And in that room, the translator is the same person making the decision. That is a dangerous psychological position. This does not mean doctors are evil. Many doctors are caring, honest, and overworked. But the system creates an imbalance. One person has the knowledge, the other person has the fear. And that combination is one of the oldest power structures in human history. Before your appointment, you know exactly what you want to ask. You may even rehearse it. But when the moment comes, your mind goes blank. Why? Because the doctor's office can trigger performance pressure. You feel rushed. You feel watched. You feel like your question might sound dumb. You feel like the doctor has somewhere else to be. So you shrink your concerns. You say, it's probably nothing. You say, that's all. You say, no, I don't have any questions. Even when you do, this is one of the quietest forms of control, the control of time. When someone controls the pace of the conversation, they control what gets said. A fast appointment trains you to be brief. A serious tone trains you to be careful. A rushed answer trains you to stop asking. And slowly your own body becomes something you are afraid to talk about. A diagnosis can help you, but it can also change the way you see yourself. The moment a doctor gives a name to your condition, your brain starts building a story around it. You are no longer just tired. You are no longer just stressed. You are no longer just in pain. Now you have a label. And labels are powerful. They can give clarity, but they can also create fear. Some people start seeing every sensation through the diagnosis. Every headache becomes a warning. Every heartbeat becomes a sign. Every small symptom becomes part of a bigger threat. This is how medical fear can trap the mind. The body sends a signal. The mind creates a story. The story creates anxiety. The anxiety creates more symptoms. And then the cycle begins. Sometimes the scariest thing a doctor gives you is not a pill. It is a sentence you replay for years. Most people question advice from friends. They question opinions online. They question strangers. But they hesitate to question doctors. Why? Because questioning a doctor feels risky. You don't want to seem difficult. You don't want to seem disrespectful. You don't want to make them annoyed. And deep down, you fear that if you challenge them, they may care less. That fear makes patients polite when they should be clear. It makes them silent when they should ask. And it makes them obedient when they should understand. This is where the real danger begins. Not from doctors themselves, but from the belief that authority should never be questioned. Because no expert, no matter how trained, lives inside your body. They know medicine, but you know your experience. And real safety happens when both are taken seriously. The dark psychology of doctors is not that doctors are monsters. The dark truth is that illness makes humans vulnerable, and vulnerable humans are easier to influence. When you are scared, confused, and desperate for answers, anyone with confidence can feel powerful. A calm voice can feel like truth. A serious face can feel like certainty. A medical word can feel like proof. A rushed decision can feel like urgency. And if you're not careful, you may mistake confidence for correctness. That is the trap. The goal is not to distrust every doctor. The goal is to stop becoming powerless in front of them. Ask questions. Write things down. Bring someone with you. Request explanations in simple language. Ask what happens if you wait. Ask what alternatives exist. Ask what the risks are. Because the most dangerous patient is not the one who asks questions. It is the one who is too afraid to ask anything. Doctors can save lives, but the room they work in can also expose one of the deepest weaknesses of the human mind. When we are afraid, we hand over control. And sometimes we don't even notice. So the next time you sit across from someone in a white coat, remember this. Respect their knowledge. But don't surrender your mind. This is Mind Trap. Subscribe for more stories about the hidden psychology that controls human behavior.